Welcome to this week's edition of AI in Healthcare Updates, covering the latest breakthroughs. Brought to you by Lucid Quest, HealthBench sets a new standard for evaluating clinical AI. It scored 5,000 dialogues on 48,562 physician-written rubric points. GPT 3.5 Turbo scored 16%, GPT 4o 32%, O3 reached 60%, and GPT 4.1 Nano beat GPT 4o at a fraction of the cost. OpenAI's Jakub Pochodzki says reasoning models are now generating insights autonomously, marking a milestone for economic AGI. He highlights merging pre-training and reinforcement learning, with AGI impact now measured by a $100 billion ROI goal. The Dragon benchmark tests LLMs on 28 Dutch clinical tasks, using 28,824 annotated reports. Domain-specific pre-training lifted scores to 0.77 versus 0.73 for general models. 10 tasks still underperform, pushing for open, scalable benchmarks. An instruction-tuned Llama model scored greater than 90% micro F1 in social determinants of health tasks, beating clinical BERT in low-resource settings. Gaps remain on rare labels and variable documentation, prompting open standards for equity-focused AI. Reddit data helps track overdoses. Among 1.7 billion comments, fentanyl mentions strongly correlate with CDC death data at 0.89. Adding Reddit's one-month data improves overdose forecasting, enabling near real-time epidemic monitoring. Digital tools in IBD improve visit frequency and adherence, but do not impact remission or quality of life. Reviews call for longer trials. Apps are best used for monitoring and patient education, not as standalone treatments. ACP's new MS caregiver bot, built on ChatGPT, answers questions about symptoms, self-care, and finances. Backed by EMD Serono, it supports 1 million caregivers with round-the-clock help. Somite AI raised $47 million to build DeltaStem, trained on a massive cell signaling dataset. It aims to scale production of therapeutic cells for diabetes, orthopedic, muscle, and blood disorders. Boehringer Ingelheim partnered with Tempus AI to refine oncology strategies. Using Tempus's Lens platform, BI will access clinicogenomic and imaging data for biomarker discovery and patient stratification. Huma acquired Aluna and its FDA-cleared spirometer, expanding its respiratory monitoring to 150 U.S. clinics. This elevates Huma's remote care capacity and supports global trial expansion. To reshore generics, U.S. agencies fund 4 teams, including Battelle and Cost Plus Drugs, to make 8 sterile or oral drugs domestically, with FDA filings expected in 12 months. In maternal care, Google and Drive Health launched Nurse Avery, delivering phones, Fitbits, and AI assistants to 56,000 at-risk women in Illinois to improve outcomes and reduce costs. AI has identified a stromal biomarker linked to aggressive ER-positive breast cancers. Found in routine pathology slides, it signals earlier onset and poorer outcomes, opening doors to cost-effective prevention. Stay ahead in AI in healthcare research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert